needs of people are addressed in such a way that the next pandemic should never find us in the way we are today. So those things should be addressed. So we have to look at post-COVID as in a way an opportunity to reset. The chair, when he opened, he said, we mustn't waste a crisis. Indeed, we mustn't waste this crisis. We must look at the economy, the structure of the economy, the ownership of the economy, the decentralization of the economy. And that's why we are more and more talking about districts, so that every district must have vibrant economic activity. So the decentralization of economic activity, the broadening of the ownership of the economy, and the transformation of the structure of our economy has to take place. And in the process, address some of the glaring needs that were very much exposed, whether it's in infrastructure, whether it's agriculture, food security, whether it's in transport. Those things should be looked at. And of course, that has also got to look at the women, the youth, to be part of the economy, and we have to small and medium enterprises, and also the co-ops are established, and we make sure that they are active and they are part of building resilient, sustainable local communities. So that's what I would say, Honorable Deputy Chairperson. Thank you.
You have not answered all the questions, ma'am.
You were not recognized, member.
Neither were you. With all due respect, Honourable Minister, the question about the class suicide has not been answered by you.
Who is this chairperson?
That's not a question, that's a political statement. Chair, can we please be abused by honorable members? This honorable member is very out of order that is talking here about class suicide. It's a political statement. They are so desperate to make points whenever they wish.
Chief Whip,
my apology, Chair.
Can you allow me?
Yes.
You requested me to chair the meeting. Can you allow me? Honorable member, Honorable to chairing this meeting.
On the point of order,
I want to say now there is no orders that I will take now. I am taking questions from members that indicated that they are going to ask questions, and we want to express our appreciation to Honorable Nkosazana Dlamini-Zuma. You responded to the practical issues that is important for the people of South Africa.
No.
So thank you very much. There is a member from KZN that indicated that this person wanted to speak. Can the member from KZN, if you are actually forfeiting your turn, I will give to Honorable Klute, but I first want this one that said KZN to speak. Please.
I would also like to ask a question, Chair.
By raising your hand, I will get your name from the host officials. Honorable Majola, can you continue?
Thank you very much, Chair.
Honorable Chair, this is a travesty. I'm writing on a point of order. You must at least listen to the point of order, please.
I listened to your point of order. You raised the issue, the political statement that was made by Honorable Mikalakas. Now I'm requesting to continue with the meeting. Honorable Klute is unlike you. Honorable Okamp and Honorable Klute. After Honorable Majola, it will be you that will be speaking. Can we continue?
KZN now is forfeited.
No, is it forfeited?
Huh? KZN?
No, continue. Continue. Who
All
is
right.
speaking?
It's member from
KZN.
KZN, yes.
Tubani gama lako.
Thank you very much. My name is Ricardo Mtembu. I'm the chairperson of COCTA in KwaZulu-Natal. Let me start by welcoming the presentation brought from the MEC of Health and the MEC of COCTA, and appreciate the leadership provided by our president and his team. And of course, as the chair, when he was opening, alluded that this pandemic came whereby the country was not aware, no one was ready for it. But we must appreciate the leadership that has been able to rise above. As I'm sitting and listening to the meeting, I'm concluding that we have some who have interest of the people at heart, and we have those who have their own narrow interest. I think we are aware of the wedge drivers who want to individualize the collective decisions, and we encourage our leadership to rise above. The masses are behind them, and we believe that, of course, we will reach a destination. And also, we want to commend the MEC of COCTA, irregardless of attack unfairly that is directed to her within the collective.
What is the question?
But I think she is in line, and she understands what is happening on the ground in terms of the cigarette, and we believe that the collective is correct. My question then, with the chairperson unelected, the unelected chairperson there, my question is, how are we going to address the issue of reprioritization of budgets and IDPs in the municipalities, particularly because there are municipalities who have been struggling before the COVID-19 in terms of finances. And currently there is a challenge of revenue collection because some ratepayers, they are affected by the situation of COVID. So my question is any plan, because I'm not sure whether the funding that was promised or was announced by National is going to be able to assist municipalities. If you go to some municipalities, roads are damaged like you never before, you'll never believe. It's unwalkable in those roads, and other infrastructural problems. So therefore, what is the plan to assist the municipalities to ensure that at least they not suffer more than what they have suffered? Thank you very much to my leadership.
Thank you, Honorable Mtembu. Honorable Kluti. ABC Kluti.
Chair, sorry to bother you. Before he comes on, will you recognize me as
Honorable,
well?
both of you are following Honorable Kluti. Remember, you indicated you want to speak in the second round.
Thank you.
So, Honorable Kluti.
Thank you, Chairperson. I was listening to everything that was mentioned today, and one screenshot that the Minister of Health showed us was the lack of income, hunger, economic downturn, social distress such as funerals, religious events, weddings. And I was wondering by myself, how did we end up at this in the world? And I'm going to speak about that elephant in the room right now, because we need to attend to that elephant as well. We need to know the truth about COVID-19. There's little doubt that COVID-19 originated in China. The coronavirus started there. And I'm concerned when I read what happened in China, where people were muted, they were silenced because they were not allowed to ask questions about coronavirus. Now, the past few weeks, there's been a growing concern and questions about how the Chinese Republic or the government there handled the coronavirus situation. And there's growing requests that there is an independent investigation to be done into how they did they managed the whole coronavirus situation. My question to the Minister of Health, as Minister of Health of South Africa, will you support an independent investigation into China so we can have the truth about how the world and South Africa and our provinces came to a point where we have lack of income, hunger, economic downturn? Will you, Minister, support such an investigation. Just another question regarding the hotspots. You mentioned mentioned Mangaung quickly, and you just quickly said, and I quote, the various history of Mangaung being added as a hotspot. The maps that was circulated doesn't make sense. The one map shows Mangaung is actually quite safe or not that distressed, but now Mangaung is added to that hotspots. What was the reason for Mangaung being added? And then the last question is, we hear, and the other ministers can answer this, we hear smoking is bad if you're a possible COVID-19 candidate. But there is research showing the contrary, and I don't want to go into the merits of that. But my question is, for any research, scientific research to be done, you need to have peer review. So in other case, how it works is, for science to be scientific, you need to have an investigation about your theory. You have the data, you gather the data, and then you come to a conclusion. But you have to have your peers scrutinize your findings to say this is scientific. Can we have the peer review and the science behind the information we are getting that COVID-19 is, or smokers are at risk when you for COVID-19? And I'm actually concerned about the fact that the minister read the information from the WHO. It's just a statement. It's not really research, just a statement regarding smoking and COVID-19. In fact, the WHO says in that same statement, they are in the process of conducting new research every day. So can we have that peer review, that hard data and scientific data to show us that smoking is bad for South Africans? Thank you.
Thank you, Honourable Klute. Honourable Boshoff.
Thank you very much, Deputy Chair. Minister, it's only natural for one to question the monitoring mechanisms of your department that are in place to ascertain that the figures provided by provinces are a true reflection of the reality on the ground. Given the fact that in some hospitals like the Grey Hospital and the Matata Hospital in the Eastern Cape has been reporting that the nursing staff are refusing to treat patients due to the lack of PPEs. Flights have been grounded, resulting in many tests or specimens being transported by road for up to 9 hours between provinces, and that information that has been shared with us indicate that a quarantine facility in Mpumalanga, 13 persons under investigation had escaped. There's also the issue of massive backlogs of test results that causes one to also question the figures we are being provided that are not as close to reality as one wishes to believe. What monitoring mechanisms, Minister, does your department have in place and are utilizing to ensure accurate results? Can tests that are being transported by road be trusted for accuracy? Will you ensure that all medical staff on the front line are provided with adequate PPEs and guarantee that every quarantine facility is secured so no persons under investigation do not escape and become a risk to others who are infected? Thank you, Deputy Chair.
Thank you, Honourable Boshoff. We will give to Honourable Mutsamai.
Thank you, thank you, the Honourable Minister. I just want to ask the Minister, how will the department assist the municipality that is under Section 139 on COVID-19?
Is it your question?
E.g. like Northwest. Did you get my question?
Is it your question?
Yes, yes, ma'am.
Is Honourable Goya? Honourable Anel Goya.
Thank you very much, Honourable Chair. I just want to first start by saying that we appreciate the briefing from both ministers and we welcome such an extensive briefing. But one needs to say maybe education needs to be broadened. It is an appeal that we need to broaden education so that people can understand the health hazards that are involved in smoking, which are even accepted by the manufacturers and distributors of cigarettes or tobacco products. Because even in the packaging, it is said that smoking attacks the lungs, smoking kills. So we shouldn't be malicious and behave as if it's a wrong phenomenon, which is a scientifically proven fact. What we need to do is to call on SAPS. It's a call that we want to make, that there should be a call on SAPS to intensify the fight against illicit trading of cigarettes, because that's the problem that we are sitting with currently. It works against the gains. But I want to ask the Minister of Health in terms of the health education programs and what their partnership is with the municipalities to ensure that we broaden health education, especially to the poor communities that do not have access to media. So I think we need to check that. And finally, I just want to say that so far, none of our ministers has been seen to be committing class suicide. Hence, the masses of the people are still with us.
Honorable Zoya, if you
Let them go ahead with that work.
If you finish your question, are you through with your question?
Yes, Honorable Chair, I'm done.
Honorable Du Toit.
Thank you so much, Jane. Minister, the Minister mentioned that much effort is put to provide more sustainable water supply by means of boreholes. Now, currently in areas like Lichtenburg in the Northwest Province, some boreholes can't be used as a result of contaminated underground water by sewage spillages. Minister, can you confirm that as you can confirm, it has been found that COVID-19 has been traced in human stool or feces and of infected patients? My question, can the Minister confirm that it is impossible for boreholes to be contaminated by the COVID-19 virus as a result of sewage spillages? And then my second question, Minister, as a matter of transparency, could the Minister please provide a detailed list of everyone that forms part of the National Command Council and the reason why the country haven't been supplied with such a list up to now? Thank you.
Thank you, Honorable Du Toit. Honorable Matibe.
Thank you very much, Deputy Chair. Part of my question has been covered in relation to the budgets in municipalities. But the question that I want to put forward is what is the impact of COVID-19 on what delimitations, more especially public participation, and also what will be the role of the department to ensure that public participation indeed happens. Thanks.
Chair, are you still there?
Honorable Muhai, we seem to have lost The Chairperson, do you wanna continue? Honorable Nyambi?
Who's following, Zama? Who's following?
Yes, I agree that the House Chair can proceed, whereas the Deputy Chair is lost connection.
Honorable Nyambi?
Honorable Nyambi.
Once is available. Who's following, Zama?
It's Honorable Christian.
Honorable Christian?
Thank you very much, Honorable House Chairperson. My question is to the Health Minister. The infection statistics have been relatively consistent with a mortality rate of just below 2% and an infection rate of around 3.5%. One of the most senior advisors of our Ministerial Advisory Committee and the chairperson of the South African Medical Research Council, Dr. Glenda Gray, came out against slow, gradual phasing out of the lockdown and certain regulations, stating that such an approach is nonsensical, unscientific, and has resulted in a spike of malnutrition cases, most notably among our young children. What the country is witnessing now is a concerted effort by yourself, your department, and others who seemingly do not wish to accept facts predicted on science. This has further been proven by the support for Dr. Gray by more than 250 members of the national and international academic and professional community. It is also important to note that Dr. Gray was the same medical professional who spoke out in 1998 against the then Minister of Health, Dr. Dlamini-Zuma's decision to block AZT, an antiretroviral that would have prevented mother-to-child transmission of HIV. This, while the ANC was secretly sponsoring Virodine, a locally developed AIDS drug that was rejected by the scientific.
Is this another presentation? Is this another presentation, Chair?
I'm coming to my question.
No, she's making a statement now.
The ANC government historically rejected medical and academic professionals when making decisions that could profoundly dire consequences on our people's lives. How are South Africans expected to trust this government to transparently and decisively deal with this pandemic and consequences of the lockdown, such as mass insufficient food supply and inevitable malnutrition? Thank you, House Chairperson.
Where's this question?
Zama? Was that the last question?
It can't be the last question, Chair. My hand is up.
Zama?
My hand is up.
Honorable House Chairperson?
My hand is also up.
Honorable House Chairperson?
I've also requested. Can you give me the last two? My hand is also
I'll give you the last two. Honorable members, I'll give you the last two numbers.
Up for quite some time now.
My hand has been up since the beginning. My hand has been up since the beginning, even before
Zama, can you give me the last two hands?
Honorable Nita will be followed by Honorable Dango, Ambassador Dango. Thank you, sir.
Honorable Nita, and then followed by Honorable Dango.
But we've been raising our hands.
Thank you very much, Chairperson. Chair, my question goes to the Department of Health, Chairperson. When the minister was presenting, there was a graph that indicated that the Eastern Cape Chair and also the Western Cape, they have a number of people that are undetected who are infected by the coronavirus. What I would like to know from the minister, what is the plan to track such people? Because really, they can cause a serious damage to the two provinces that are seriously affected by the virus. The second question, Chair, is on the issue of beds. There's also indicated that the two provinces, again, they are having a very high number of infections. Yet in terms of beds, they are very low. Again, I would like to know, is there a plan in place to address those two challenges? And appreciate the work that the two ministers, through their council, that they are doing in curbing the coronavirus and the selflessness that they display in terms of ensuring that the poor communities, they get help. Thank you very much, Chair.
Thank you, Honorable Dango. Thank you very much, Chairperson. My question is, how prepared are schools to deal with the pandemic? Is there enough and sufficient protective gear there for teachers? And is there an education program to actually teach and students and pupils about this pandemic? Because this pandemic is not going to go away tomorrow. This pandemic is going to be with us for a long, long, long time. But also an appeal to us as members of this House. We are in this pandemic. We are joined together in this. Let us not use this pandemic to play politics. It does seem that we want to play politics with this particular pandemic. We are playing with people's lives, and we should not do that. Thank you.
Minister
Thank you.
Dlamini-Zuma.
What do we do then?
Honorable members, let's allow the Honorable Minister to respond to the questions.
But
Honorable
we're not given an opportunity to ask questions. We've been raising our hands.
Zama, no. You are not the only one, Honorable Zandave. Honorable Minister Mkhize.
Thank you very much, honorable members. Thank you for all the questions. And thank you to the chairperson for offering me the opportunity. The one question was raised by Honorable Mthembu. I do want to thank Honorable Mthembu for his kind words around the issues on the presentation and the approach to the pandemic from government. I think the issue that we are grappling with relates to the challenges to our budget as a result of the difficulties that are going to be enforced on our ability to maintain infrastructure. Even this morning, this is the issue that we've been discussing together with the Ministers' Committee on Budget. It's a major challenge, and I think we have to really work together because there will obviously be an impact on the maintenance of infrastructure. And so a lot of reprioritization will become necessary. So I do understand that aspect. The second issue raised by Honorable Klute refers to the slide wherein I spoke of hunger, social distress, and issues of loss of income and economic recession. These issues were basically tabled in the first meeting when we were discussing on the best way of prioritizing the lives of our people and took a decision on the lockdown. The approach was that immediately the lockdown is going to offer us a lot of advantages in dealing with the rapid spread of the infection. However, it will be very important for us to always consider that there will be other unintended consequences that we must always avoid. And as a result of that, the president had then gone out to announce the package of social relief to help with additional support in terms of the social grants, as well as the assistance to those who are unemployed, opening up UIF for those who were working but were not able to continue with work, support for small businesses and huge businesses. So the response to the issue that we raised, we're basically saying there's a balancing act that we have to take into account. But we have already done the balancing in the sense that, firstly, we have gone to issue this package, which is supporting, to deal with the distress. We have also been involved in the consultation with various leaders of the church and the religious formations to look at how we can manage the issue of having to reintroduce activities at the level of the religious gatherings. We have also looked at a number of other issues that relate to
how we can get back to normality. And that is in response to the fact that we knew we needed to keep a balance on the way. That's why the president spoke about a risk-adjusted strategy of easing the lockdown. So this we have dealt with. The issues that are being raised across, in the media about questions around China, certainly we have noted those issues. However, we have not really been favored with any issue that relates to any suggestions that there should be a reason for investigating any reason to what we call wrongdoing from the point of view of the Chinese government. So we wouldn't really be part of that call. We would really say that we have noted a lot of lessons from China, from many other countries, and we do get lessons from the good work that they did in trying to contain the virus, and that in fact they have been the one country that's been able to halt the numbers from rising too rapidly, together with Korea and a few others. But many other countries, we're also learning from them in terms of what they are doing, even things that we must avoid, as it were. That is why we took our own approach to say, we may not be reducing the numbers, they may not be declining yet, but our situation, our conditions are such that we have to keep our own balance in this regard. So we would not therefore have any basis to call for any investigation on China. We actually believe that we'll take lessons from all over the world. The other issue that relates to hotspots, well, if anyone was watching would have noticed that Mangaung was amongst the parts of the country where there was a rapid increase in the earlier infections and positivity rate, and that to be a lot of work that was done in that area. It remains at risk, and so we have in the slides indicated some of the areas that we're watching that we have to take into account, areas where we think that there's still a risk of a rebound infection, and so that's why we have a look. We took that view on Mangaung, but the reality is defining a place as a hotspot is not a punitive decision. It's a decision to introduce additional, health teams to support the area so that we can improve our response when the infection begins to rise again. So it's not a punitive issue. So when we look at it, we need to understand that we're trying to reinforce that particular area. So we're keeping it on a watch for that reason. The issue around smoking, look, I don't think I want to take time to get onto what the member is doing. The dangers of tobacco are well established in courts in South Africa, in the United States, in different parts of the world. And so I don't think people must come and argue here that there's any benefit you can get from smoking. There's none. So let's not argue that way. If people want to sell cigarettes, if people want to smoke, then let's deal with it on that basis. But not deal with it because we think that there's something wrong if we say that tobacco is not good for anybody's health. It isn't. So let's leave the issue. Let's just focus. If people want to debate the issue from the point of view of saying that they've got businesses and so on, that's a different matter. And so in this case, there's no need for any peer review. We will accept the statement by WHO, and there is no benefit to anybody's health that comes from smoking. That's it. So I think we must understand that the real issue that arose here arose when there were definitions of essential services. And again, you can never say that's where tobacco is essential services. So the debate of what the business impact would be, the profits and so on, it's a very different debate. It mustn't be linked to health because there is no health benefit from smoking. The matter is in court, and so we'll leave it at that. The Honorable Boshoff raised the issues about Umtata and Freya. Yes, we have received those comments. In fact, they are members of seemingly, well, let me say members of staff, because some of them have spoken to them when they've sent messages around. We are following all of those. And certainly, I think we should accept that In a number of hospitals, there will be tensions where people feel they're not well protected. And I found that that would be a result of either inadequate training, so people don't understand what level of PPEs they need. And in some areas, there may well be challenges of PPEs. And so whenever there's a complaint of this nature, we go in there and investigate. I raise the issues with the MECs, and they've sent members to go into that area to try and attend to those issues. Every now and again, when these issues arise, we take them seriously, and we want to make sure that our members know that we will always protect them. We will make sure that PPEs are available. And if they feel that they are not well protected, they must raise the issue, and we will deal with it at that level. So it's very, very important that all those issues that are raised are actually being dealt with. The persons under investigation who escape must be arrested. We go and get the police to charge them and get them back so that they must be under isolation. No South African should be allowed to go all out and knowingly infect other people by actually going out and spread the infection when they've been asked to isolate. So that's a standard approach, and we hope that people will always be explained to so that they don't take it wrongly when they're asked to isolate. Because it's not a punishment; it's a precaution that you make sure that you don't infect other people. So it's very, very important that we must work together on this. And that's why I think I agree with those who have said education is going to be very important, that we ensure that all the people understand that it's not a punishment, it's actually for the good of your other fellow South Africans, that you don't go around spreading the infection. But it's not also a punitive issue, it's a matter of care that we have to give you some treatment if there is a need for it. So we will continue to work together to ensure that people understand this fact so that people can cooperate. Then the question of tests.
Honorable members, let's allow the minister to respond to the questions that we have asked. We are protected, Honorable Minister.
Thank you. The question of tests, if there's any specimen that is not suitable, the experts in the laboratory will always indicate. So we must always feel that they are having our best interest, and so they will be able to guide us. And so I think we must leave the issue in their hands. At the moment, we won't even interfere. If the laboratory felt the specimen was unsuitable, that's it. It will have to be redone or whatever. But I think that they have the right as the laboratory experts to be able to guide us on that issue. So there wouldn't be no problem on that part. The Honorable Nzama raised the issue of the municipalities under 139. We don't have any specific focus onto the municipalities on whether they are 139 or whether they are on their own administration. All we're looking at is what is it that we can do to help the municipality to respond. And in this case, we have indicated a number of approaches. Firstly, the issue of community screening. The department at the provincial and national level will always go and reinforce the capacity on the ground to make sure that the screening takes place as expected. The case management, similarly, we will make sure that we will deal with the patients irrespective of whether the municipality is on 139 or not. It doesn't affect anything. Then when there's a hotspot and we need to intervene, or whether there's vigilance, we'll always make sure we work with the local structure. I think what is important from this member to say is that all the municipalities do need to be involved. Whatever the mode of administration, they have to be involved in us fighting, particularly as we deal with the issues of containment. So we'll need everyone to be working together. And the issue of being under administration is a local issue of how the decisions are taken. But in terms of what we're talking about, it's something that's going to happen on the ground, in the wards, in the sub-district, in the entire municipality, in the entire district. Everybody needs to participate irrespective of that state of 139. So it shouldn't affect us a lot. Then the other Honorable Goya raised the issue of support to communities with no access to the media. I think that question is spot on. We have to really mount a very strong publicity campaign to make sure that people have a proper understanding of what they can do to help us fight the pandemic. It's also important because it must be individual decisions that people take to ensure that the distancing is observed, to ensure that they do hand sanitation and use of masks. So all of this basically means that we have to continue. There'll never be a time when we'll say we've done enough on that on that aspect of communication. We have to communicate until everybody on their own can share this with their neighbors, with their friends, with their families, so that they are the ones who are monitoring and ensuring that there's a social behavioral change. Honorable Tutor, the issue of Lichtenberg sewage spillage, I'm sure the Honorable Minister, my colleague, will assist us to support those areas to see how they can get those things corrected. However, the bulk of the COVID-19 cases have actually been attributed to droplet infection based on an upper respiratory tract infection, where the contamination or the infection basically arises from to infect other people nearby. So from that point of view, we don't really take the issue of sewage as being a major factor here. All we're focusing on is that this droplet infection. We believe that the numbers are such that let's focus on what is clearly obvious. Obviously, that doesn't mean that we need to allow this the contamination from underground spillage of sewage. That's a separate matter altogether. It causes more gastroenteritic kind of problems with a coliform contamination. That is a very different issue. It is a problem on its own, but you don't associate it with COVID-19. Well, I'm sure you can write to the Director General to give you the names of who sits in the Command Council. There's nothing secretive about it. Unfortunately, I can't give a list as we speak right now. Then the other honorable member raised an issue of statistics. Well, I think we are quite comfortable with the statistics that we have, and the issues that are raised about the government working with scientists. Actually, this matter I have clarified in the public arena that we've got a Ministerial Advisory Committee and a number of other experts that give us support, and we have made it public that anybody who would allege that we don't support, we don't work with scientists is actually untrue, that statement. We have also clarified the issue of the malnutrition in Baragwanath. Again, that we have indicated that is actually untrue, as it were. And so that for us is an issue that is not for debate. It's an issue that's just a matter of upfront accuracy or factual accuracy of the statements. The other questions that are being raised relating to the statement made by Professor Glenda Gray, I got a call from her that she wanted to discuss this matter and considered on a number of issues, and she was going to do a public correction of issues that were she understood were wrongly attributed to her comments, and therefore make that retraction. So we left the issue at that, and so as far as I would be concerned, there is no basis to even suggest that there's any interference with the academic freedom of anybody. I did note that there were other academics who had written a petition or they had written a statement in the public. However, I thought that the assumption that there was any threat to freedom of expression or academic freedom was misunderstood, because there is no such. Every scientist is very welcome. Every academic is very welcome to express their views. And certainly, as in a normal democracy, if anybody argues and expresses their views, they should be understood and respected as such. But when those views are incorrect and factually incorrect, they must be corrected. And that is basically the reality of how any democracy should work. And so I think we will just note that the public, as far as we would be concerned, is actually properly led with a scientific basis of the actions that we take. There are differences of opinions here and there, but I think what has been good is that all the political parties and everyone out there has actually focused on the fact that this is a major challenge for South Africa, and there's no need for us to politicize it. There's no need for us to grandstand on it. There's no need for us to try and score political points about it. We must just keep the public properly informed. And so whenever there's any sense of disinformation or inaccurate information, we'll step up to the fore and actually get it corrected. The Honorable Ncita raised the issue of contacts who have not been conducted, who have not been found. That issue is a matter of concern. As a result, therefore, we have taken the approach on the hotspots, which is what we are implementing in Cape Town City Metro, as well as other areas nearby which are affected, and other provincial centers where we see that the hotspots existing. The purpose of the intensive health experts intervention that we're putting up there is to actually make sure that we create a strong community health response. We are able to strengthen primary health care. We're able to make sure that all those who are positive are actually identified and are taken to isolation, that all the contacts are also traced and are taken to quarantine, because that way we will actually interrupt the cycle of infection. And when we've done so, we'll then make sure that going forward, we detect new cases and cut down on the spread of the infection. I must say that the outbreak in the Western Cape is a matter that is of concern and is really occupying our 24-hour concentration in terms of what else needs to be done to contain the situation there. We're not expecting that we must close down the spread of the infection. It's not possible to do that. What is possible for us is to actually make sure that we keep dragging on the infection so that it doesn't spike immediately. And so we will continue with that. Now, the plan, therefore, is that we're increasing the number of beds for quarantine. We have actually, in the Western Cape, sent a team which is led by Nicholas Crisp and Dr. Nicholas Crisp and Dr. Kerrigan McCarthy and a few others to go and reinforce all the experts that we have sent into the area. They're working very closely with the MEC for health and also working closely with the head of department. And that whole team is actually giving to us the response that we need to make sure that every sub-district within the metro has got a wall-to-wall access to additional health care. Once this has been done in future, this would really help us to build a very sound system, because the real challenge in the Western Cape is that the patients are landing in hospitals. You've got the best care at the hospital level, but what we need is to reduce the rate at which people are landing in the hospital, because that's what will actually reduce the swarming of the hospitals by large numbers. So that's what we're dealing with in the Western Cape, in the Eastern Cape, in all the hotspots. So that is the plan for both isolation as well as for quarantine. And when we talk about uptake of beds, we're basically saying we need to increase those numbers. So part of the issue in the Western Cape is the cost. Now, the cost of treating a patient in a hospital, some of them, if we use the hotels, for example, the cost is high. So at the moment, we have actually got the Ministry of Police offering the police colleges to support the Western Cape Department of Health to quarantine some of the people and create more beds. There's also support from the Army. So those are the plans that we're working on in the particular area. Then Honorable Dango has raised a very important question about the readiness as we go back to school. Again, here we are working very closely with the Minister of Education. It's important to increase the level of understanding of what needs to be done in the schools. I've seen that the unions are also still very anxious, so we are going to be working together to refine the protocols for returning to schools and also make sure that whoever needs to be protected will be protected. It will be important as well to understand that the overcrowding in the schools needs to be mediated by creating extra capacity to be able to open up distances between the learners, and also make sure that for every child they are able to use the cloth mask, which even the parents can make themselves, and that within the community, they don't need to go for N95 masks, they don't need to go for expensive masks, they just need simple cloth masks, which we all can use, and all of that's going to be important. But I must say that this is early days and this is all new, so what is important is for us to learn from each other and give suggestions that will help us to improve the return to school. As we're looking at it, we're going to be having this pandemic for the next 2 years or so. And in the process, it's not sustainable to actually avoid going back to school. We will keep improving as we go along and we'll learn as we move on. So that is really how far I can take it. Chairperson, thank you very much.
Thank you, Kabazela. Thank you, Minister of Health. Honorable members, as we are aware of the time, and we are very clear about our role and mandate of the NCOP. So we decided that as the House that represent the interest of these different provinces, we are going to allocate a maximum of 3 minutes for each province. We are aware that we do have some MECs and relevant members of the portfolio committees in our respective provinces, so that all of us will have a better picture of what is happening in our respective provinces over and above what is being presented by the ministers. So I will do them in alphabetical order, starting with Eastern Cape, the relevant honorable member from Eastern Cape.
Chairperson, on a point of order. House Chair.
Honorable Mokause.
House Chairperson, there was a second round of questions which was identified by the table staff. Are we still going to get that round of a question, or are you taking it away from us?
No, the arrangement was that if we given minister just 5 questions, it was going to be a second round. But instead of 5 questions, we went beyond even 10. And you're not the only one. There are a lot of us that wanted to ask some questions.
House Chairperson, ANC members and DA members have been making political statements here. It is only fair for you to give us this round of questions, because we haven't asked the Minister of Health questions as yet.
Honorable
So
Mokause, I don't want to.
Only fair that way.
Honorable Mokause, I don't want to get to the debate of political parties. I was following when we started, and I know that in the first batch you are also recognized, but let us not debate it. The ruling is that now let's get to the provinces.
Who made that ruling? Because it was never even put before the House. Who made that?
I'm making a ruling as I'm presiding.
I'm objecting to the ruling. I'm objecting to the ruling because you know very well that those people who...
Let us not debate it. There's a procedure to follow if you have got a problem with the ruling.
I do have a problem now.
What is the reason now for us to be here? We've prepared
Why are we here?
Ask questions. We have put in a lot of research and questions that we prepared, and now we can't ask questions. So what is the purpose now of this exercise here?
No, don't create an impression that questions were not asked.
No, it's not an impression. No, it's not an impression.
Point of order, Honorable Chair.
So what is the reason for us to be here?
A member of the EFF is still on the floor. Can you the member who's
I'm asking, what is the purpose of us being here? Because we came in the meeting to ask questions, and we are sitting now patiently waiting to ask questions.
But the chair is saying it's a continuation of questions by provinces.
No, this is unfair. This is not fair.
Honorable members.
Continuation, Chief Whip, it's a continuation, but you know very well.
The Honorable Chair.
Members who are going to be asking
honorable members.
And it's unfair.
The Honorable Chair.
Honorable members.
The Honorable Chair.
Allow me to make this statement. Honorable members, we do have time allocated to this session. It was not for the whole day as we debated when we started. And there are honorable members that are going to rush to other meetings. There are meetings organized for today.
Let's excuse them. Let's excuse them.
No, Honorable Kause, we are out of order.
Nothing to do with us.
we stick to the
we have to set all the hours now until the meeting is closed. We can't.
Let's have Eastern Cape.
Just now.
Eastern Cape is
given.
Eastern Cape on the mic.
Is the chairperson, is that person of the Eastern Cape now an ANC person? We cannot come sit here.
Honorable Makausi, you are not the only one who raised the hand.
We
could
cannot
not
come
talk.
and clap
Please.
hands for ANC ministers. We need to hold them accountable.
We also some of
that
us
you're
from the
engaging in
ANC
of
raised their
giving
hands.
ministers,
Please.
give MECs opportunities
Order.
is for ANC to clap hands. And we're not in the business of clapping hands here.
Honorable Chair,
We're here to hold them accountable.
We can also clap for you. We have been raising our hands. You could not get an opportunity, and we understand that. Let's
You
go
know
on.
you knew very well that ANC MECs are gonna get a chance and you'll be covered. This is very much unfair. We want the round chairperson to ask the Minister of Health questions. We still have questions.
Honorable Chair, can I
let's
be
take
recognized?
the last round then.
Yes.
No, Honorable Chair.
No.
Honorable Chief Whip, let me take the last three. Yeah, I'm going to allow 4 hands.
To ask questions.
There were already people identified. Let Zama give you the names.
Don't waste more time. Mkhize, speak on the question. Don't waste more time. Let's get to the questions. Agree.
Thank you, Chairperson.
Mkhize, ask your question.
Let me speak. Honorable Nyambi, if you want 4 more people, it's Honorable Brauterset, it's Honorable Mahlangu, Honorable Makause, and Honorable Foster.
No,
Okay.
let Honorable Makause ask questions. Forget
Honorable Makause.
Thank you, House Chairperson. Minister, we have this category of healthcare workers. They are lay people. They do not have a proper clinical training, but they do the bulk of the work during this COVID-19 pandemic. These are community healthcare workers. When are you planning to give them proper job, insource them, and give them a living wage? We wrote to you, Minister, as the political party, the EFF, that can you please give us the racial age demographics of people infected with coronavirus? This information is very important because we cannot at this point generalize. Lastly, Minister, with all the rush by the ruling party, and of course, with the pressure from their white friends who controls the economy of this country, you have eased the lockdown regulations. And this has posed a lot of danger to the people of South Africa. Hospitals are still without PPEs. For instance, Kuruman Hospital in the Northern Cape, Kagisho Health Center in the Northern Cape, and even Mahatma Gandhi Hospital in KZN. When are you planning to correct this, Minister? Because the virus is continuing to spread, particularly in Black communities. Thank you.
Honorable Mahlangu.
Thank you, Honorable Chairperson. My questions is related to COCTA, but I think even the Minister of Health as a team will be able to assist in terms of this. I want to draw the attention of the team, of the ministers, about the issue of the status of schools, the readiness of the opening of schools. That the attention should be given to rural schools where sanitation is a challenge, water is a challenge. And I had Honorable Minister Nkosazana Dlamini-Zuma spoke about the meeting that they had yesterday. Fortunately, I also attended the local command center. And from where I'm standing, there will be a challenge and the local municipality is unable to help. The other issue that I need to report that needs attention of the team, the command council, is that in our area, I'm from Mpumalanga in Nkangala region, Tembisile Hani municipality. There's a former Kwandebele legislature. There are a number of offices, departmental offices there. And because of the challenge that we have of water, it's a very serious problem. And this has been discussed also in the local council yesterday. And we would like to assist because we have tried to check whether Public Works, Roads and Transport can help, and the municipality, they also have their challenges. So I think drawing in the Minister of Water and Sanitation to come closer to the situation here, it will help, because it's really problematic for departments like SASA, like Home Affairs. They don't have public toilets, and they work with senior citizens, and it's like we don't care. Also, the same. I'm proposing
Honorable Mahlangu, two questions.
I'm still on the two questions. I'm proposing, Chairperson, of a way forward that on both areas. Can we please request that the mobile toilets be given to these areas so that we cover the concerns of the public? Thank you.
Thank you. Honorable Fesser. Honorable Fesser. Honorable Okam.
Thank you.
Honorable Okam.
Thank you very much, Mr. Chairperson. My question, yes, can you hear me?
Yes.
Okay, thank you very much. My question is just, what justification is there for the lockdown regulations to suspend, limit, and supersede the Constitution and other laws without explicitly mentioning the provisions of the Constitution or other statutes that allow for this? In that such curbing measures enforced through the regulations have been counterintuitive to South Africa's own socio-economic challenges, such as the freedom of movement and access to food and water, that saw many NGOs prohibited from feeding the poor. It was only due to recent litigation efforts launched by the Democratic Alliance that saw this poorly thought continue operating. Can I please get an answer on that question, sir? Thank you.
The last one is Honorable Zandamela.
I haven't asked him later. Thank you.
Honorable Zandamela. Zandamela. Let's agree that we're done with the second round. So we go back to the Honorable Minister. Honorable Nkosazana.
Are you not taking provinces once, Chair?
Or before we can go to Honorable Nkosazana, let's take the provinces that are available so that he can deal with everything. Yes. Let's allow Eastern Cape to comment. Eastern Cape.
Thank you very much. Hello.
Hello, MEC.
Hello, MEC.
Thank you very much. Good afternoon to everybody and good afternoon, Chair. Chair, I must first appreciate this opportunity. It has indeed opened up some other issues that we would want to actually speak to. I would want, on the basis that the issue of both quarantine and isolation sites has been mentioned about the Eastern Cape, to immediately get onto that. That the Eastern Cape made a decision not to really rely on private facilities, but rather to actually use the opportunity to create some legacy in preparation for our own NHI program. So what we have been doing now, we've been getting more years. The statistics that were given by the minister may be correct, but up to now they are a bit shifted because we're now opening more of the sites that we're opening. However, in conclusion, at the end of the day, we shall be realizing 8 big facilities that we're building as government, where we're taking 500 beds in each and dividing them both for one site, which of course will have separate entrances into isolation, quarantine, and take a few of those, which is about 10 beds in that center, into EICUs. what we are doing with those are issues and facilities that we shall use beyond COVID, so that it starts to actually assist us in terms of the backlog that majority of our country knows where the Eastern Cape comes from. I'm leaving that into a situation that starts to say it will, when added together, come up to the 10,000 beds that the Eastern Cape is creating. On the other issue of PPEs, which most of the time we had a seat for, I would want to actually first appreciate the intervention of the minister when he gave us a team that was able to actually work with us, assist us both in issues of identifying the need for PPEs, plan for them, and our weakest link was only about monitoring. As such, we've gone into hospitals, we've taken stock of what they have, we've gone into our system, and if you look now, the strikes about PPEs and lack of PPEs are fewer than we had them. Of course, we do believe that the fact that we were having weaker OHS teams, occupational health and safety teams, could have been contributing to the whole factor. That now we're strengthening those teams. We are immediately looking at that there will be no issues. Those platforms will be able then to actually take care in terms of what are the issues that each facility is actually looking at. What I would want to add on to end with is that we're still finding it a bit, however, the assistance both by the Minister of COCTA and the Minister of Health, when the Premier of the Eastern Cape requested for bilaterals between the Western Cape and the Eastern Cape on the issues of both the interprovincial travels and the issues of funerals that were mostly coming from the Western Cape, and where we would find ourselves in a problem. I would want to actually say that is starting to actually indicate as to which direction we're going, because as the Eastern Cape, we have now started to look at what guidelines we can contribute to, which are not, of course, going to impact negatively or be against the national guidelines as to how issues are done. So for that, I do believe for the Eastern Cape, prevention is quite critical, and prevention must be underpinned by communication that starts to go to our people, and we start to say, we do not believe that there will be a time that we believe that communication, education, information in terms of our structures would, at the end of the day, be something that says it is not an important factor in terms of us looking at COVID. Well, I would not actually speak, Chair, on the other issues that I think we've addressed that are covered in a report that was not actually done by the Eastern Cape. The report that says our specimen travel 9 hours to another country or another province. I think that has been a misinformation. I tried to explain it that there's no such in the Eastern Cape, even at the time that they were traveling to NICG in
As you conclude, MEC?
As I conclude, we are not in such a situation, Chair.
Thank you, MEC. Free State.
Thank you very much.
Thank you, MEC. Free State.
Thank you.
Good afternoon, and thank you. Chair. Thanks the ministers, Dr. Mkhize and Dr. Dlamini-Zuma. We are joining this call and very delighted that we've made tremendous progress also in flattening the curve in the Free State. We accept that the uncertainty of the virus is definitely going to have far-reaching implications. And they say that it's going to introduce a new normal into our lives. We've made some strides in the Free State on both the isolation and the quarantine sites, and we've also put aside a number of beds that would be required in the emergency cases. But we've also sought to create a habitable environment in our societies by ensuring that we have, to a large extent, close to 80–90% uninterrupted water supply, especially during the time of the lockdown. And we've gone extra mile to create even boreholes in rural areas and in farms where communities did not have access to water. We also have brought water tankers and trucks to supply water in areas that are remote and most other areas informal settlement. We've even reduced clustered informal settlement. Around 1,600 families were moved to create space so that there's good environment for living of people. We emphasize that supply of electricity, because people were required to stay put in their houses, is also uninterrupted, even though there are challenges, but at least majority of our people have been able to benefit from that process. We emphasize that sanitation was also a key area, because there was then a huge demand as people were now more in their own houses. We redoubled our efforts on the refuse collection as well. On the education, we made arrangement with all speakers in the municipalities and especially ward councillors to go around with loudhailers to educate people, encourage them, and inform them about the dangers and encourage them to stay in their houses. So to that extent, it's a continuous program, because civic education is critical in people taking charge of their lives. We have observed the regulations, and the participation and the response of communities has been very encouraging, to an extent that even as the alert levels has been increased, people have been adhering, especially in putting out masks and observing the distance, despite the challenges of social conditions and to a certain extent, economic conditions. I want to indicate that
as you conclude,
very hard as we conclude that during the threat of the virus, we really learned the true meaning of the saying that no one of us is more beautiful than the whole of us. And so we call everybody to join hands. We must fight this pandemic, and we are definitely sure we will triumph. Thank you.
Thank you. Gauteng Province.
Thank you, honorable members, and thank you for the opportunity to able to address the August House on the matters that we are dealing with. I'm just going to cut to the chase and speak about a few issues that relate to our capacity as a healthcare system in Gauteng in terms of our preparations, in terms of the beds. Currently, we have opted for an option that we are going to build internal capacity in our own facility, where we are going to add plus or minus 3,000 beds. And these are beds that will be ordinarily have not been there and would not be activated, because we also want to build the capacity beyond the pandemic in making sure that after the pandemic, we still have some infrastructure that is left. And we have got 8,330 beds, which are from both private and public, which are committed for COVID use and for COVID patients. This is the capacity that we've been building since we started off with our first case in on the 7th of March. The second part of the issue of beds is the issue that relates to the Sewage field hospitals. You would know that we actually have NASREC having completed the first phase of our 500 beds that have been put into place. We are also now starting a project which is sponsored by BMW and Nissan in the north of Gauteng, around the area of Zwelini, where we're going to put our next field hospital in case there's a surge that is going to happen. The issue of our field hospitals is also that we are having a semi-temporary base where we're going to be able to use the same field hospital beyond the pandemic. So just to conclude my points on the capacity of the facility in terms of beds, is that we are also building new beds in our own hospitals. The 4 hospitals that we have earmarked for those beds, it's Krisani Paragwana, it's Kopanong Hospital in the Val, it's George Mukari, and it's also Jubilee. And these are beds that we are going to put up using alternative building technology, which will be ready by the end of July. We also want to address the issue of the new approach in terms of changing of behavioral management of our communities. in relation to increasing awareness and education and enforcement of regulations. I think it's important that we must realize that police might not be very useful in this space, but we also need the communities to be mobilized to be able to be the enforcers of these regulations and also increase awareness amongst the community. Even where we're going to deploy, this is where we're going to deploy most of our QBED doctors. So teams have already been put into place to do the ward-based interventions, particularly in dealing with hotspots and also with social mobilization. We are hoping that this is going to be the nucleus or the backbone on how we're going to build the primary healthcare system beyond the pandemic. The other issue, the issue of the hotspots, which we are dealing with, you will realize that we have a new emerging hotspot in West Rand, which comes from the mining side of things, where the infections have actually increased sharply in West Rand. And West Rand was one of the districts that were in the safe zone in the last week actual statistics. But here it's an issue that we wanted to raise on the involvement of the Department of Minerals in terms of regulation and the Department of Labor. But already we are having a meeting to engage with them to enforce some of the regulations actually tomorrow. So one thing that we also have actually realized is that we also, as the Department of Health, have to embrace our role as a public health custodians and also people who are supposed to be the ones running the public health, meaning that the preparations for the reopening of schools, by and large, is not only a Department of Education role, but it is the role that the Department of Health should be playing. And we have been working with our department in terms of training of the screeners or health marshals as they were, and in terms of preparations of the regulations, how the screening will be there. We are concluding a memorandum of understanding with our general practitioners who will be able to assist us in maintaining and monitoring and also running the surveillance around the school health system. And also this, we are looking at it beyond the pandemic, where we're going to have a nucleus of the primary healthcare system. So in all, the honorable members, is that this has been a very useful session. It's important that we also appreciate the role that the Department of Health must be playing also in the public health and also in the environmental health. And I think it's an important thing that we also need to look beyond the pandemic and use the pandemic as an opportunity to fast track some of the reforms of implementation of universal health coverage going forward. I would like to take the opportunity and say thank you.
Thank you, MEC. KwaZulu-Natal.
Good afternoon, Chairperson. Good afternoon to the honorable members and the ministers. I will also just be straight to the point and appreciate the opportunity to make this presentation. I must also indicate that as the province of KwaZulu-Natal, we also took an approach that says it's necessary for us firstly to restructure the facilities that we currently have and extend the beds that we extend the facilities and get as many beds as we might be able can possibly get out of our facilities. And in that process, we've been able to get close to 3.5 beds within the different facilities. And we are talking about hospitals that are both in the urban centers and in rural areas. The number of hospitals that we are speaking to are close to 14 that we are reconstructing or that we are reconfiguring for COVID-19. But I will just name a few. A hospital like Richmond Hospital, which is in Mpumalanga, Clarewood Hospital in eThekwini, which we have named as a COVID hospital in its own entirety, a hospital called Slower Hospital in Zululand, and we are doing the same thing. In Zwelini Hospital, we are going to be putting up a temporary structure, and there's quite a few other hospitals in the rest of the province. What we agreed on is that every district must at least have one facility that is teamed to be a COVID hospital that will be able to provide us with the beds that we need, and therefore we've had to renovate or reconfigure some of those facilities. But with that said, we will do that with the facilities, our own facilities. We are also putting up field hospitals in the province. We've done that. We are currently working on the exhibition center, which is eThekwini. We have concluded the field hospital that we have built in Royal Showgrounds in Mpumalanga, and we've got a few others. So we've decided to do that. And we also have some private facilities that have donated their beds, particularly private hospitals in eThekwini, and that is what we are also going to be utilizing. I must also indicate that when the pandemic started, we had a bit of a challenge with the PPE as well. However, right now we don't have challenges, but what we decided to do so that we are sure that the PPE is utilized in a proper manner, but also that every facility has a PPE as and when it's required. We elevated the issue of the management of the PPE to a DTG in the province of KwaZulu-Natal, and on a daily basis, the district directors are able to provide a spreadsheet on how far are we with the PPE, which facility is short, and we are able then to intervene where it's necessary for us to do so. It has worked very well because it has also kept the abuse of PPE at other levels. Sometimes we found that our PPE gets lost without us knowing what has happened to it. So this management has really assisted us. The third element that I want to speak to is the infection of health workers. We are quite worried about this phenomenon. What we then decided to do was to go into the facilities and conduct a proper investigation or some scientific investigation on what causes these infections that we seem to be getting in some of our facilities. There are two elements to this issue. The first one is that more than half of the infections that we are getting from health workers do not actually come from within the facilities. These are infections that some of our health workers pick up in the communities and in their homes. Often they're not aware that they've been infected, and they will then bring the infection into the hospital, and then it starts spreading and infecting other health workers. But we've also picked up that health workers themselves, they seem to relax when they start being amongst each other, mingling with each other, and they relax on the protocols that they need to implement in relation to social distancing, covering of their mouths and all of that, and then the infection starts spreading. But we have then implemented a program of engaging the health workers again, because we started doing this at the beginning of the pandemic, but we are now redoing or re-educating the health workers and reminding them that they need to be on their guard and need to be aware at all given times. We have also decided to employ new health workers or new staff for both our new beds that we have created in our facilities and the field hospitals. Let me indicate that initially, as the province of KwaZulu-Natal, well, for the past couple of years, we've always been short-staffed when it comes to nurses, enrolled nurses and enrolled nurse assistants because of the cost-cutting measures that we have as a province. However, the Provincial Executive Council has now given us authority to go ahead and employ more nurses, more enrolled nurses, and whatever other staff that is necessary to run a hospital. And we've started employing those. We need close to 2,500 nurses. We need 1,800 enrolled nurse assistants, and we have started with the process.
As you conclude.
Okay, as we conclude, we are working very closely with the Department of Education in relation to their opening of the schools, and we have agreed that we are going to be deploying our community caregivers to those schools that need to be screened so that we are able to assist them in this matter. Thank you very much.
Thank you, MEC. Limpopo. Limpopo.
Good afternoon and afternoon to honorable members. I hope I'm audible.
Yeah, you are audible.
Okay, thank you, presiding officer. Thank you very much for giving us this opportunity as Limpopo. And I hope I've greeted everyone so that I don't take away my 3 minutes. What we are doing as a province in terms of responding to COVID-19, I'm not gonna bore you with in terms of our provincial command council, which is led by Premier and has got different key task committees that are dealing with those issues your disaster management team led by Coxter, and the outbreak response team, which is led by health, and others like your JOG and so forth. But let me come into the outbreak response team, which it's being led by health, because in terms of Coxter, they will give you the full report in terms of provision of water, and also their school readiness. We're working as that particular collective team to find that, to make sure that our schools are ready in terms of the water.
Doctor?
Honorable Chairperson, we seem to have lost the doc. Do you want to move to the next presenter?
No, let me move to the next one while still trying to get hold of the doc. Mpumalanga.
Thank you very much, Chairperson, and afternoon to the members of the NCOP. As a province, we can indicate that we are, as presented by the Minister, in terms of our numbers, and also indicate that in terms of our approach, we are increasing in the number of screens. We are no longer just focusing, of course, in your door-to-door program, but also in terms of your taxi rank, in terms of your malls, and also your roadblock. So we are everywhere in terms of making sure that those that we don't get in their homes in the door-to-door programs, but we are able to get them wherever they are, so that we screen as many people as possible in terms of identifying those that have got symptoms, so that we can quickly isolate them and quarantine them for those that are positive. We can further indicate that in terms of now, we've started in terms of taking our specimen to Rob Ferrer in the province, because previously we were taking in Gauteng, but now that we've started in the province, hence we have seen the number of increase in terms of testing also in the province. And I think now it's better off than it was happening before. We are prioritizing the safety of our frontline workers, our employees, making sure that they've got the proper PPEs. Hence, we have also extended, we are working very well with all the unions in the department, so that as over and above the report that we are getting from facilities, we understand that they are leading in those different facilities. They are able also to work with us, so that if there's any challenge, they can also report to my office specifically to say, MEC, we've got challenges in this facility, so that we can at all times make sure that our employees, our frontline workers are safe at all times. So hence, so far we have not get any challenges in terms of that regard, but also not only focusing on our facilities as a department, but also in terms of private sector. We are monitoring them to make sure that workers in that private are also safe, so that we don't get them being infected while they're at work. They need to be safe at all times. The focus in terms of our epicenters in the province, we had 2 epicenters, your Nkomazi and Dr. Pixley Isakaseme. We can report that now we have seen a huge improvement, because our approach is that immediately when we approach a municipality, we lock down that municipality, we make sure that everyone is screened, everyone that has got symptoms are tested. We're working very well with the different municipalities, so that we are able to decrease the number of infection in that regard. So we are working very well. Hence, we've seen the 2 epicenters that we were having in terms of the numbers. When Nkomazi, we had 21, now 20 are fully recovered, and 17 at Dr. Pixley, and now we've got 15. So we are closely monitoring all the municipalities in terms of the numbers, so that as and when we see that the municipality, because our challenge in the province was in the main supermarkets, but I can say that our tracing team in terms of contact, because within 48 hours, we are able to trace all the contacts. We are able to make sure that if it's a supermarket, they close immediately, they fumigate, so that we don't have the infection spreading in that regard. So I think in that regard, we have tried to, and we are doing well with working together with the different municipality and the different sectors. Now we have seen the opening of the mines, the cases around your Sasol, but immediately went there in Gavenberg, local municipality, and we're able to trace every contact, and we're able to make sure that the spread in that area is not increasing on a daily basis. So as a province, we can say that we are not relaxed in terms of making sure that also our quarantine facilities, we are monitoring that in terms of the public and the private one. We are trying to increase. We can also indicate that in all our hospitals, we have identified units and extra bed where we're going to isolate people in that regard, so that we don't move patients from one area to another, but at that level of a different hospital in our province, we are in a position to isolate them. And also we can say that we are looking at the issue of extending the quarantine facilities, because now with the internal transmission, it shows that we might have to have many facilities that we are going to use at a provincial level. But we can say that as a province, that's where we are, and we are continuing to monitor, continue to make sure that we don't have many, in the main, we are focusing on the behavior of our people, educating them so that we are able not to increase in terms of making sure that at all times they wash their hands, they prevent by— As you conclude, Mpumalanga. Yes, so we are in more on education because of the number that we are having, so that we don't increase at all costs. We are educating them, and we are making sure that they understand the importance of them being prevented and being safe at all times. Thank you, Chairperson.
Thank you, MEC. Northern Cape.
Well done.
Northern Cape.
They are not there.
Okay. Northwest.
Thank you very much.
There's nothing from Northern Cape is there.
Northern Cape.
Chairperson.
Is that Northern Cape?
Okay, yes, that's Northern Cape, Chair.
Okay, Northern Cape.
Thank you very much, Chair, for the opportunity, and Honorable Chairperson, and the Deputy Chair, the ministers, and my colleagues at large. As Northern Cape, just wanted to speak on two issues, Chair, which is capacity and other skill issues. With regards, as we are preparing for the peak, Chair, we have ensured that we have to close gaps on the beds we are giving currently. Currently, for the hospital beds, we have 150, and the current time is 1,360. So we need to close the gaps that the gaps we are having is 1,257 in preparation for the peak, as a focus that was done by the NEC. So we have decided in two models, Chair, where we will have repurpose our facilities, and as well as putting up field hospitals in the areas that we need to ensure that we put up field hospitals. So those are the approach that we're taking, that we ensuring that as we put up field hospitals, it will be in two populations. It will be mighty, but it will be.
Chair, we can't hear a thing from the Northern Cape province.
Raise the voice a bit.
And I'm not audible.
We are audible. Let me see. Raise a bit. We are fine. MEC. Northern Cape. MEC.
The MEC is muted.
MEC, you are muted. MEC.
Chair. Is unstable.
Chair.
Let's go to Western Cape. Western Cape.
Good afternoon.
Yes. There's a
Western Cape.
Northwest.
There's no person from Northwest.
Northwest, I'm here.
Oh, what? Northwest.
Chair.
Northwest.
Yes, can I speak Northwest?
Yes, we are recognized.
Thank you very much, Chair, Portfolio Committee members, and the two ministers. Chair, our approach is focusing first on promotion and prevention. In there, we are dealing with advocacy, especially covering the issue of attitudes of our people, the issue of attitudes of health workers, the issue of stigma in communities and employers, of course. The case that we have of a person who died, the family is living very difficult where they are because they are accused to be the ones who have brought it to the community. The case of a worker who had earlier recovered is that the worker is consistently refused to go back to work. We're working on that. The second issue, which I think that is critical, is the issue of workers returning to work, especially those that return in numbers, mine workers in this regard. Remember the current lockdown for yesterday, level 4 would have been 50% of mine workers returning to work. But within that, the issue of strengthening the enforcement of quarantine and testing for those that are returning. In fact, even before they go to work, they should be quarantined, tested, and then post the period of 14 days, then be the time they're going to work, because the problem is that it is quickly spreading whenever one worker goes underground, because that worker does not go underground alone. He's with workers in a cage and he's working with other workers in the workplace. Therefore, the issue of starting with quarantine as compulsory, and then in that process, screening and testing them, then give them 7 days and let them come back to work when everything is known that it's cleared, would help us. We think that the Command Council and the Minister of Health could help us there with the Minister of Mineral Resources. The third issue, Chair, is that the province is preparing to open an isolation hospital, like what the Minister had said. The 270 beds donated by Anglo Gold Ashandi, Westval in Kletstow. We want to use it for a provincial isolation center. These areas that want to do isolation on are cases which necessarily are not cases due for admission in hospital, but they are proper to be isolated so that contamination and spreading does not happen in numbers. The fourth issue, Chair, that we are dealing with in the province, it's almost like what Gauteng is saying. Approach on developing extra capacity for the current facilities so that we then have a value of COVID-19 intervention post the response period. We have identified 6 facilities. We're dealing with extending ICU and general wards in ensuring that we create extra capacity and ensure that those facilities would then be ready for NHI post-COVID-19 response. The fifth element being the preparation for the field hospital, preparing for the surge. We're already working with them, partnering with the mining industry, identifying areas where we could jointly deal with them. Already we have 150 beds received between partnership between Health and Royal Bafokeng. We are now working to ensure that the 500 is secured for the future. The last element being PPE. On PPE, Chair, we have a very clear campaign. We are campaigning openly to educate and tell health workers to use PPE, and that in our facilities there might be notice boards of which PPE should be used for which area, so that as they are going to areas of work, they know what PPE is relevant for that area. We're both doing element of campaigning for donations, which the mining industry has been working with us very well, but we're also purchasing on our own as the Department of Health. Other than that, in terms of beds and everything, the presentation of the minister that I saw there was highly recent, because he had covered everything up to the last time he was announcing the results last night. So most of the issues are covered by the minister's presentation. Thank you very much, Chair.
Thank you, MEC. Western Cape. Western Cape.
Can you hear me?
Yes, I can hear you.
Thank you, Chair. Thank you very much for the opportunity. We'd like to make some comments, first of all, to the Minister of Health.
Where's the MEC of the Western Cape?
Get your points correct. Don't start that. Read the letter that went out.
Honorable members, Allow me to chair this meeting, please. I don't need assistance. Can you continue? We are protected.
Thank you very much.
Who's she?
My name is Mireille Wenger. I'm a special delegate. I chair the ad hoc committee on COVID-19 for the Western Cape Provincial Parliament, and I'm also the chief whip.
Where's the MEC? The MEC.
So we'd like to, first of all, thank the Minister for...
Where is the MEC? That's the question.
Chairperson, on the point of order.
Honourable members.
No, we want
the speaking
of the Western to address us, like the other MECs has done.
Honourable Special Delegate, you are protected. Can you continue?
Thank you very much, Chairperson. We would like to thank Minister Mkhize for providing support to the Western Cape and committing to fund additional human resources for new field hospitals. Our biggest challenge is the testing backlog and delays from the National Health Laboratory Services. These were mentioned in the presentation, but we currently have a backlog of 18,000 tests for the Western Cape. As the Minister is aware, we need to be able to test healthcare and frontline workers quickly to determine if they are COVID-19 positive. And we need rapid testing to manage the identified hotspots. Reliable data is exceptionally important in combating the spread of the virus. If we can't measure, we can't manage. So on behalf of the Western Cape, I therefore request that the testing backlog and the availability of rapid testing be considered as a matter of urgency. Would the Minister be able to indicate his department's plan to resolve this? Secondly, to the Minister of COGTA, Dr. Dlamini-Zuma, in the President's most recent address, he announced the allocation of additional resources to identified hotspot areas. Could she please clarify when we will see the allocation of these resources and what form they will take?
Where's the report of the
presentation today?
No, this is not a question session, Chairperson.
No, man, we are out of order.
Today,
it's not a question session, really.
No,
the assistant,
not a question time now, please.
Chairperson, if I may, from the presentation today, it seems that assistance will only be available beyond September.
To ask questions now.
Municipalities will
No, really.
Chairperson, really, this is
to the NCOP with questions.
Special delegates have been asked to provide an input in the session.
Now
the Western Cape is being prevented from doing so. Would you please call those members to order?
Honourable members,
not questions.
Honourable members, I don't need assistance, and let's allow her to conclude what is raising. Whether it's raising question or it's raising a comment, it's entirely up to her as a special delegate. You can't prescribe to her what to raise and how to raise it.
Yeah, but Chairperson, we didn't get a chance to ask those questions. I'm from the West. I didn't get a chance to ask those questions.
So the member of the Western Cape, please stay in order.
Conclude? As you conclude.
Member, please, you are out of order.
Thank you.
You are out of order.
Thank you very much, Chairperson, for your assistance. Then to wrap up, I'd like to say municipalities will require more information and much sooner than what is being proposed in the presentation today. Could the COGTA department undertake to gazette additional resources and the amounts per hotspot and what form of assistance will be provided as a matter of urgency so that municipalities can plan? And lastly, we ask that the regulations for level 3 be released for public comment so that residents can receive reliable information and make responsible choices. Thank you very much.
Thank you. Salga?
Chair. How are you, Chair?
Fine, how are you?
Thank you very much for the opportunity, Chair. This session has helped us to convene and remind ourselves of
Honourable members, if they are not recognized, just mute. Salga.
Thank you very much, Chair.
And thank you very much for this session. And this session to us, it reminds us of the doctor's pack. And it's only one doctor that is out of the two that has been called to come to this house. And let me then welcome the opportunity provided to us as South African Local Government Association, recognizing the chair of the House, deputy chair, the chief whip, the House chair, and members of the House. Chairperson, let me start by saying we appreciate the intervention made by our government since the period in which the declaration of the disaster was made. And however, we have got some issues that we need to front load, and for those that are in power to look at them. For instance, Chair, the President have announced 20 billion rand allocated to municipalities, and this 20 billion rand, to our dismay and our unhappiness, we are learning that is only going to be released end of June or end of July. And this is going to be a big problem to the municipality financial abilities today. As we know that last time there was half of the 350 million rand that was released, and it was dispatched to municipalities. And the worst of all, one municipality in the Northern Cape received 29,000, whereas that municipality is expected to perform a full work of the COVID-19 and its conditions. And this, it can't be an issue that we must take it lightly. The third issue, Chair, there is an issue pertaining to the non-stop of supply of water and electricity to communities, which municipalities through COPTA have adhered to that call. But the disadvantage to this call is when the ESCOM and water boards are allowed to send notices of their intent of stopping supply of bulk water to communities, and which it will have a serious problems into our communities going into the future. Chair, the fourth issue that we wish to highlight is that we must know that since the COVID-19 has been declared, municipalities have been facing serious challenges. One of the challenges, the expenditure, and second challenge is the drastic reduction on payment from business, households, and departments of the government that's supposed to pay municipalities. And these challenges, if are not addressed, are going to pose a serious challenge into the local government system. We wish to say, if the minister responsible is not intervening with these issues, we are heading for a perfect storm of collapse of municipality system, possible strike by municipal workers when they will be needed the most by the communities as we enter the deadly phase of the pandemic. As I conclude, Chair, I wish to say part of this, we understand that municipalities won't be able to pay salaries of June, and this put more pressure on the local government system for it to function and respond. We are making a call that if a disaster has been declared, it should affect everybody. It should not be an expectation of a particular sphere of government to perform, and other spheres of government takes laxity and do not perform such duties. Thank you very much, Chair.
Thank you, thank you. Colleagues, allow me to take this opportunity to indicate that since we are facing this challenge of COVID-19, as Parliament, after the leadership of the institution convened, we have had more than 200 virtual meetings. And the first meeting was with the MEC of Health, Dr. Mkhize. So now it will be in order to allow to concluding remarks after the Deputy Minister of COPTA is going to be the Minister, Dr. Mkhize. Then it's going to be the Chief Whip doing a word of thanks. Deputy Minister of COPTA.
Sorry, Chair. Are you not going back to Limpopo and the Northern Cape?
You are out of order, Honorable Koia.
Honorable Koia, I don't need the assistance and create this unnecessary
the same platform for the next meeting. please.
Honorable members, of course, we have had some glitches when we started. That is why even myself, I started by doing a coup when the deputy chair had some challenges of connection. So it's like saying, are you not going back to the deputy chair to start again? Those are outcomes of the process that we have to live with. Let's allow the deputy minister of COGTA to do concluding remarks. And honorable members that still have got questions and issues, you can still write to the relevant ministers and they will be attended accordingly. Honorable Deputy Minister of COGTA.
Thank you very much, Honorable House Chair, and thank you very much to the honorable members. I'll just make a few comments on matters that have not been covered yet. The first is that there is a question that was asked in relation to the support that's being provided to municipalities, in particular with reference to the 20 billion rand allocation. In terms of the stimulus package that was announced by the president. And I think it's always important to start by saying that we look at that as part of a package of interventions to support local government. And just to go through these very quickly. The first was an initial allocation in terms of the disaster relief grant, where we used the equitable share formula to allocate to all municipalities equitably the disaster relief grant. The second was to allow that municipalities are able to redirect their own budgets and resources in terms of the Disaster Management Act to deploy in areas that would be necessary to mitigate the impact of the pandemic. The third was that the municipal infrastructure grant and the urban settlements development grant in metropolitan municipalities. An allocation has been made or provision has been made that resources that are unspent in these grants can be redirected to address COVID-related challenges with a further provision that in fact this could be rolled over subject to the municipalities meeting basic conditions, such as that the money should be available in their bank accounts and accountability processes. And the third is, the next is that various departments have made different allocations. So as COGTA, we've made allocations towards boreholes, through NISA in partnership with the DBSA and other partners. We've invested in boreholes, and so has the Department of Water and Sanitation in terms of water tankers and so on. And that's one set of interventions that has also been made. And then the last is with regards to the 20 billion rand, where it was agreed and Treasury has indicated that this would be part of the adjusted budget, the budget adjustment that would be submitted to Parliament at the end of June. So it's only after appropriation that these resources can be dispersed. We are currently working with National Treasury on a criteria for the disbursement of these resources. Now, notwithstanding this, we acknowledge that these resources will never be able to fully cover the pressure points, but it is continuously trying to find solutions within the resource constraints that we have as a republic to address the challenges that confront all of society, all of government, including our local government system. I think it's also important to state on a point that was raised earlier that with regards to boreholes, when they are drilled before the water is supplied to communities, the water is tested for safety and appropriateness to serve communities. So it is not a case where we simply just drill and then the water is supplied. But before the water is supplied, there is a process of testing this water. The next point I thought I should make relates to whether there will be any additional resources gazetted by COP. I should state and restate that, in fact, ultimately all budgets are appropriated through National Treasury. So there isn't a special provision where COGTA is sitting with a bucket of money that it can pull through and say, we will now reprioritize this to meet the municipal needs. It's part of the overall country's budget that is being presented. Our approach is to work with National Treasury to ensure that where these resources are required, that they are deployed adequately. I think the point that was raised by Salga with regard to ESCOM and water ports is a matter that's receiving attention through the task team that is led by the Deputy President, the Cabinet task team on ESCOM. So these matters have been presented with regard to liabilities by municipalities to water ports and to ESCOM, and possible solutions to a whole comprehensive set of issues that need to be addressed. So these are receiving due attention through a process that's convened by the Deputy President. And I should say that we did get to present to this task team 2 weeks ago, and we're going back this week with certain elements of implementation of the recommendations that were agreed to there, and also with the intention that in subsequent weeks, we would also be able to follow up on other elements of implementation. The point around salaries in local government has been raised. It was also raised last night by the mayors, with the mayor suggesting that we need a case-by-case approach to this. We have taken those suggestions into account, Honorable Stofile, and would be able to feed back to local government what can and what can't be done in terms of the recommendations that were made by the local governments here through the mayors and Salga last night. Thank you very much, Honorable.
Thank you, Honorable DM. Honorable Dr. Kabazela.
Thank you very much. Thank you very much, Chairperson. Honorable members, thanks for the questions. Just to indicate briefly, the honorable member that raised the question about community health workers, it should be important to just make the member aware that the origin of community health workers was started as a community program wherein people who are recruited to work for the community, and therefore the role they play is linked to the response that they have to give to the community. It was not meant to be a full-time kind of occupation. It was meant to be to allow people to serve their community at the same time, also do their own day-to-day work. And so it was not considered as a full-time job that has to be classified in the way that the member is indicating. We have, however, agreed to do the wages to a level which is agreed right across on the basis of a kind of minimum wage level. So that has been kind of taken care of. The issues of the racial, demographic and other features of the infected individuals, we haven't really seen that question, so it might be on its way. So we'll have a look at it and see whether it's something that we can deal with. But nevertheless, as we speak, we are aware that the infection has affected South Africans right across. And to try and racialize this infection in terms of whether it's the poor or the rich, whether it's white or the black, may be misleading, because we believe that the infection will not stop to attack anybody as long as the conditions allow it to. It's not necessarily linked to whether you are white or black, and therefore you can be affected or not affected simply on that basis. So we will nevertheless look at the question and deal with it. Insofar as the issue of the easing of the lockdown, this was a decision that was carefully weighed by the National Coronavirus Command Council as well as the Cabinet. And so you can just rest assured as members and the public that everything has been considered to take the steps that we have taken. I have indicated that we've taken into account a whole lot of scientific advice, WHO issues, our own conditions, health considerations, social, economic, and various other considerations. So that's what really has been used to determine whether we continue with the lockdown and whether, in fact, we should take an abrupt reversal of the lockdown, or we take what we call a risk-adjusted approach. That's the decision that we've taken. And so it's important for us to indicate that I have had the member was even thinking that we had white friends who were advising us on that. Let me say that government doesn't have such friends. And so in this case, we have dealt with this issue based on the, the rationality of the decision that we had to take. The questions of the PPEs in the hospitals, member raised the issue of Kuruman, Mahatma Gandhi, and so on. We correct this issue as soon as we become aware that there's a challenge, there's a high demand for PPEs. And so when that happens, we always want to make sure that every district is able to equitably distribute the PPEs and ensures that all the hospitals that need it and all the centers that need it will get it, even if they didn't have it in their stock. So we will always make sure that there's equitable distribution. So for any member that feel that there's a challenge in their area, we're happy to investigate and then just correct that. At this point, we have actually stocked adequate PPEs, and we know that the consumption will be high. So there'll be areas when this might be on demand, and therefore there might be shortfalls. We expect the provincial government to step in at that kind of level and assist. The issues that were raised in relation to prioritizing rural schools, I think it's a very good point, but I think that's been dealt with in relation to COGTA, and so we will not go too much into that issue, other than to just note the comments that's been raised about Nkangala, about the sanitation challenges on SASSA queues and so on. So that was something that we're going to keep in mind. The Honorable Member Okamp raised the question about the authority of the lockdown. Well, this is something that, as I've indicated, has been used in many countries now as a way of dealing with the interventions. Under the disaster, declaration of a national disaster, it allows government to take such steps into account that will be useful for the protection of the lives of people, to make sure that our people are kept safe. In this case, that was the best way of ensuring that our people are safe from the infection, and this has been proven in many other countries. So if there were any concerns around the role of the NGOs, it is fair that those get raised and get be discussed so that we can resolve those. I don't believe that those issues are quite fundamental. Let me also then pay tribute to the MECs, who are excellent partners in provincial governments to actually lead the fight against COVID-19. I have only to say that they've really been in the forefront of the fight as the provinces, and we work together very well. And so all the issues that they've raised, the issues around new sites, beds being opened, and that more new information, they've got more new information about additional beds. I accept that, because we have actually discussed to say, let's increase the availability of field beds, hospital beds. And I really must say that some of the hospitals, such as Eastern Cape, have gone all out to even pick up what was thought to be derelict facilities, revamp them, and they've actually come back onto stream. And all of this for us has been very, very effective. The next issue relates to the question of PPEs, staff, new beds, the issue of the attitudes of staff and community, the concern around returning workers. All of these are very, very important issues that we're working together with the teams. And I would say that the issues around the preparation for future health service is also very relevant. The testing issues, I've already responded to those. And the question of additional resources, if it was the MEC who was making a contribution in this question, would have probably been tabled in a different context, in the sense that we have identified areas where we need to assist each other. So there will be additional resources that will be coming from national, and therefore when that comes, we'll be able to cover the areas where the provincial governments have to extend to do work that was not originally within their mandate. So there shouldn't be a problem, because all of us understand that our teams that are working in the Western Cape already have actually raised the issues that need to be given additional attention. And on that, I think we're all on stream, we're all online. So I wouldn't think that there's any new question to respond to at that level. just to say that I'm very pleased with the cooperation that we're getting as we try to ramp up our response to COVID-19 in terms of entrenching the health expert teams in every sub-district. And so from that point of view, we really believe that that's an intervention that's going to make a lot of impact. And we hope that when we get to the community, the issue of social and behavioral change is going to be taken seriously. Thank you very much, Chairperson. We really have to ask to be excused at this point. I have an NCC meeting that is started 10 minutes ago. I have to really ask to be excused. I initially thought we're going to leave this meeting at 1 o'clock. So at this point, I'm going to ask to depart from this meeting. Thank you very much.
Thank you, Honorable Nkosazana. We are excused, Doctor. Honorable Chief Whip.
Thank you very much, Chairperson. Thank you, Chair. Yes, Chair, can I proceed?
Yes, proceed, Chief Whip of the NCOP.
Thank you very much, Chairperson. And first, I must recognize you as a House Chair, Chairperson of the NCOP and the Deputy Chair, all members of the National Council of Provinces and the special delegates, the Minister, Comrade Zwelini Mkhize, and the Minister, Dr. Nkosazana Dlamini-Zuma, and the Deputy Minister Pakstar of Kokta, all MECs who join us today, all MECs from the 9 provinces, MECs for health, and MECs for Kokta. In other instances, is special delegates, colleague, the Chief Whip of the Western Cape, and the chairs from other provinces. And I will just say, Chair, from the onset, we want to apologize to the MECs of Northern Cape, MEC for Health Northern Cape, and MEC for Health of Limpopo, who, because of the technical glitch, could not be able to make their presentation. But I want to, as the Council Chair, I know that you have extended an invitation that all matters that may not have been raised or reports that was not yet reached as the National Council of Provinces, it will be much proper that MEC use this opportunity to provide those reports to the National Council of Provinces. As we said, really, this is the coming to the end of a briefing session, the ministerial briefing, and this is not the first, and I believe that it will be a session that will continue as the NCOP. We take it from the Constitution and joins the NCOP to require any cabinet member, deputy minister, and the officials in the national or provincial executive to attend a meeting of the council or its committees. This section of the Constitution precisely locates the constitutional oversight mandate of the NCOP, which this briefing is in line with. It is on this basis of the briefing and the account of the executive members of this House to this House that this House can scrutinize and develop informed opinions and positions on the efficacy and effectiveness of the executive decisions and actions. The views and comments of members, critical as they may be, are legitimate expression of their constituencies and provinces and must accordingly inform the executive decisions and actions going forward. How we succeed in this cannot be measured by the level of noises we make, but constructive and persuasive arguments we present as representatives of the people. This briefing, as I said, is not the first of its kind in this House to deal with and address broad cross-cutting issues that affect 3 spheres of government. We have had it in the past, and we will continue to program that we discuss some of these matters together with our provinces and SALGA. On this note, allow me to once more thank the Minister of Cooperative Governance and Traditional Affairs, Dr. Nkosazana Dlamini-Zuma, and the Minister of Health, Dr. Zwelini Mkhize, and organized local government and our special delegates for their contribution. This was not in vain, as it has enriched our insights, not only in relation to the pandemic, but also how it has impacted on the intergovernmental relations and cooperative governance, which is the key focus of the oversight mandate of our House. Thank you once more and stay safe all members. Ke a leboha. Thanks, Chair.
Thank you, Chief Whip of the NCOP. It will be in order to indicate that we have had a number of virtual meetings, but it was for the first time to come together in this arrangement as the National Council of Provinces. And we're almost, we're more than 120 connected, and it was a successful meeting. Without much ado, allow me to take this opportunity and officially declare this one closed. So the session is closed. Thank you, all of you colleagues.
Thank you, Chair.
Good, Chair.
Thank you.
Thank you.